America's drug problem has reached a critical point. With widespread substance abuse affecting communities across the nation, the opioid epidemic, rising methamphetamine use, and increasing drug-related deaths highlight the urgency of finding effective solutions. In addressing this issue, our two groups propose contrasting approaches. One side supports decriminalization and regulation, while the other advocates for zero tolerance and extreme enforcement. Each approach aims to combat the drug crisis through different strategies, offering distinct potential benefits and challenges.
The debate over how to address America's drug problem includes two contrasting approaches: decriminalization and regulation versus zero tolerance and extreme enforcement. Supporting the latter, I argue for the implementation of a nationwide zero tolerance policy for drug use, possession, and distribution, along with increased funding for law enforcement agencies. This approach aims to deter drug-related activities through severe penalties and enhanced law enforcement capabilities, ultimately reducing drug use and its associated harms. First, I want to advocate for a zero tolerance policy among people who get caught with possession, use, or distribution of drugs. There should be severely harsh penalties, which will serve as a strong deterrent against drug use. The National Institute on Drug Abuse, or NIDA, indicates that stringent legal consequences can reduce drug use by increasing the perceived risks associated with drug-related activities. Singapore, which enforces one of the strictest drug laws globally, has among the lowest drug use rates, demonstrating the effectiveness of harsh penalties. According to the Office of National Drug Control Policy, ONDCP, a zero-tolerance policy can significantly disrupt drug markets by deterring potential users and dealers through the threat of long-term imprisonment and heavy fines. In order to do this, we would need increased law enforcement funding. Dramatically increasing funding for law enforcement agencies to combat drug trafficking and distribution at all levels is essential for an effective zero-tolerance policy. The Drug Enforcement Association, DEA, states that enhanced funding allows for more comprehensive surveillance, intelligence gathering, and interdiction operations. A report by the Heritage Foundation highlights that increased funding can support specialized training for officers, advanced technology for training for detecting and tracking drugs, and greater collaboration between federal, state, and local agencies. This holistic approach strengthens the overall capacity to present and dismantle drug trafficking networks. Also, this policy promotes public safety. A zero-tolerance policy, supported by increased law enforcement funding, enhances public safety by significantly reducing drug-related crimes and health risks. The National Institute of Justice, NIJ, notes that drug use is often linked to violent crime, property crime, and other criminal activities. By imposing severe penalties and bolstering law enforcement efforts, communities can experience lower crime rates and improve public safety. Furthermore, reducing the availability and use of drugs can decrease overdose rates and drug-related health issues, contributing to a healthier population. Implementing a nationwide zero-tolerance policy for drug use, possession, and distribution, combined with increased funding for law enforcement agencies, offers several benefits. This approach deters drug-related activities, reduces drug availability, and enhances public safety and provides significant economic advantages. By adopting these measures, we create a safer, healthier, and more productive society. As we consider drug policies, it is essential to evaluate the potential benefits of a zero-tolerance and extreme enforcement approach based on the evidence supporting its effectiveness.
Adding on to the decriminalization and regulation proposal part of this solution is also proposing a harm reduction and treatment-focused approach. This approach emphasizes investment in support services and the redirection of funds from the criminal justice system to comprehensive addiction treatment and rehabilitation programs. Evidence from various countries, states show that prioritizing harm reduction and treatment over punitive measures leads to better public health outcomes, reduces drug-related harms, and offers better economic benefits. My first argument is support services. Investing in harm reduction services such as supervised injection sites, needle exchange programs, and drug testing facilities significantly reduces the health risks associated with drug use. According to the American Journal of Public Health, supervised injection sites have been shown to decrease overdose deaths, reduce the transmission of infectious diseases such as HIV and hepatitis C, and increase access to health care and social services. A report on the European Monitoring Center for Drugs and Drug Addiction found that needle exchange programs are effective in reducing HIV transmission among people who inject drugs, as well as providing a point of contact for individuals to access further health and social services. My second argument is treatment and rehabilitation, redirecting funds from the criminal justice system to comprehensive addiction treatment and rehabilitation programs can lead to a better long-term outcome for individuals struggling with substance use disorders. The National Institution on Drug Abuse highlights that effective treatment programs, which include a combination of medication, counseling, and behavioral therapies, can help individuals achieve and maintain sobriety, reduce the risk of relapse, and improve overall health on social functioning. My third argument is economic benefits. Prioritizing harm reduction and treatment over punitive measures can generate significant economic benefits, and a study published in the journal Health Affairs found that every dollar spent on treatment programs yields a return of about $4 to $7 in reduced drug-related crime, criminal justice costs, and theft. Redirecting funds from the criminal justice system to support services and treatment can also reduce the economic burden on taxpayers by decreasing the need for costly incarceration and law enforcement efforts. The Drug Policy Alliance estimates that the U.S. spends over $47 billion annually on the war on drugs. Reallocating even a portion of these funds to harm reduction and treatment programs can result in substantial cost saving and a better societal outcomes. Argument 4, reduction in drug-related harm reduction services and comprehensive treatment programs significantly reduce drug-related harms, including overdose, infectious diseases, and social marginalization. The Lancet reported that countries with robust harm reduction services, such as supervised injection sites and needle exchange programs, have seen substantial reductions in drug-related deaths and infectious disease transmission rates. These services also provide critical support and resources to marginalized populations, helping to reintegrate individuals into society and reduce the stigma associated with drug use. By focusing on harm reduction and treatment, we can create a more compassionate and effective approach to addressing the drug problem in America. On this graph, we see the significant issue within our current approach to drug-related offenses, the disparity between high prevalence of substance use disorders among incarcerated individuals and the limited access to treatment. According to the graph, half of the people in the state prisons have substance use disorders. This indicates a substantial portion of the prison population struggles with addiction. However, despite the high prevalence of addiction, only 1 in 10 of these individuals receive treatment. The lack of treatment not only fails to address the root cause of criminal behavior, but also perpetuates the cycle of addiction. Without proper treatment, individuals are more likely to return to drug and criminal activity. This data underscores the need for a shift from punitive measures to a harm reduction, treatment-focused approach. Investing in comprehensive addiction treatment and rehabilitation programs, both within and outside of the prison system, can lead to better outcomes for individuals and society as a whole. Concluding this source, by focusing on treatment and rehabilitation, we can reduce the overall burden on the criminal justice system and help individuals achieve recovery and reintegration into society. In conclusion, from everything, investing in harm reduction services and redirecting funds from the criminal justice system to comprehensive addiction treatment and rehabilitation programs offers numerous benefits. This approach improves public health outcomes, reduces drug-related harms, and provides significant economic advantages. Successful models from around the world demonstrate that prioritizing harm reduction and treatment over punitive measures is both feasible and beneficial. As we consider drug policies, it is crucial to learn from these examples and strong evidence supporting them.
For the zero tolerance and extreme enforcement proposed solution, implementing mandatory drug testing and strict border control is included in the solution. This side of the approach aims to deter drug use and prevent the importation of illegal drugs, thus reducing drug-related crimes and promoting public safety. Implementing mandatory drug testing in schools, workplace, and public institutions with severe penalties for positive tests serves as a powerful deterrent against drug use. According to a study published in the Journal of School Health, mandatory drug testing in schools can reduce substance use among students by creating a drug-free environment and discouraging drug use. The U.S. Department of Labor's Drug-Free Workplace Program found that workplaces with mandatory drug testing policies report higher productivity, lower absenteeism, and fewer accidents. By enforcing strict penalties for positive tests, such as suspension, expulsion, or termination, institutions can reinforce the message that drug use is unacceptable and harmful. Enhancing border security measures to prevent the importation of illegal drugs is crucial for reducing drug availability and related crimes. The U.S. Customs and Border Protection highlights the importance of advanced technology such as drug detection scanners and drones in intercepting drug shipments. A report by the R&D Corporation on the effectiveness of border security measures supports the use of increased personnel and technology to disrupt drug trafficking networks and reduce the flow of illegal drugs into the country. Strengthening border control also helps in combating organized crime and drug cartels, which are major sources of violence and instability. Zero tolerance and strict enforcement policies enhances public safety or reducing drug-related crimes and health risks. The National Institute of Justice reports that drug use is often linked to violent crime, property crime, and other criminal activities. By deterring drug use through mandatory testing and preventing drug importation through strict border control, communities can experience lower crime rates and improved public safety. Additionally, reducing drug availability helps in lowering overdose rates and drug-related health issues, contributing to a healthier population. This graph sheds light on a critical aspect of the drug problem in America, the distribution of drug seizures along the U.S.-Mexico border. It highlights the effectiveness or lack thereof of our current border control measures in intercepting illicit drugs. According to the data depicted, the majority of drug seizures occur at the ports of entry, while significantly fewer seizures are made at Border Patrol checkpoints or between these official entry points. This suggests a concentration of interception efforts at specific locations. However, the graph also reveals a concerning trend: the limited number of drug seizures at Border Patrol checkpoints and the areas between ports of entry. This indicates that a significant portion of legal substances may be crossing the border undetected. The implications of this distribution pattern are profound. With a substantial volume of drugs potentially evading detection, it poses as a serious challenge to our efforts to curb drug trafficking and protect public health. This data reinforces the urgent need for stricter border control measures. By bolstering surveillance, patrols, and technology capabilities between ports of entry, we can address the gap of interception and prevent the unchecked flow of drugs into our communities. The consequences of unchecked drug trafficking extend far beyond border security. They contribute to proliferation of dangerous substances like fentanyl, fueling the ongoing public health crisis of drug addiction and overdose deaths. In conclusion, this graph underscores the necessity of enhancing our border control efforts to effectively combat the drug problem in America. By closing the gaps in interception, we can safeguard public health, reduce the availability of illicit drugs, and mitigate the devastating impact of drug abuse on individuals and communities. Implementing mandatory drug testing and strict border control as a part of a zero-tolerance and extreme enforcement approach offers several benefits. This strategy deters drug use, reducing drug availability, enhances public safety, and provides significant economic advantages. By adopting these measures, we can create a safer, healthier, and more productive society. As we consider drug policies, it is essential to evaluate the potential benefits of a zero-tolerance and extreme enforcement approach based on the evidence supporting its effectiveness.
The proposed solution to America's drug problem of decriminalization and regulation is the only suitable option. This approach treats drug use as a public health issue rather than a criminal one, and evidence from various countries and states shows that decriminalization and regulation can improve public health outcomes, reduce the criminal justice burden, and generate significant economic benefits. The first argument is that it reduces a burden on the criminal justice system. Decriminalizing drug possession and use would significantly alleviate the strain on the criminal justice system. According to the American Civil Liberties Union report, marijuana arrests by the numbers, nearly half of all drug arrests in the U.S. are for marijuana offenses. which disproportionately impact minority communities and divert resources from addressing violent crime. By decriminalizing drug use, we can reduce nonviolent offenders in prisons, freeing up resources for tackling serious crimes and enhancing public safety. Argument 2 is that it has a health-focused approach. Treating drug use as a public health issue enables individuals to access treatment and support without fear of criminalization. The Substance Abuse and Mental Health Services Administration, in the report Behavioral Health Barometer, United States, Volume 6, states that access to treatment reduces drug use, improves health outcomes, and decreases criminal involvement. Portugal, which decriminalized all drugs in 2001, saw a substantial decrease in drug-related deaths, HIV/AIDS transmission rates, and drug-related crime, according to the Lancet's article, Drug Decriminalization in Portugal. A health-focused approach encourages individuals to seek help, leading to better public health outcomes. Also, it generates significant economic benefits through regulation of drugs. Regulating and taxing drugs can generate significant government revenue and reduce economic costs related to drug enforcement and incarceration. The Journal of Policy Analysis and Management found in the budgetary implications of marijuana legalization in the United States that legalizing and taxing marijuana nationwide could generate up to $28 billion in tax revenue annually. Keep in mind, this is only marijuana. Imagine the amount gained from taxing other drugs. This revenue could fund public health programs, education, and infrastructure. The Drug Policy Alliance estimates that the U.S. spends over $47 billion annually on the war on drugs. Redirecting these funds to treatment and prevention could yield substantial benefits. In the graphic, Then and Now, Portugal's Drug Decriminalization, it highlights the difference between Portugal in pre-decriminalization versus post-decriminalization. The overdose deaths in 1999 were 369, whereas in 2016, post-decriminalization, there were only 30. In 2000, there were 907 new HIV diagnoses due to injecting, whereas in 2017, there were only 18. And the number of people incarcerated for drug offenses in 1999 was well over 2,000 compared to the number of people incarcerated for drug offenses in 2017. This graph compares drug-related outcomes in Portugal before and after the implementation of decriminalization measures, which demonstrates the positive impact on drug-related deaths, HIV/AIDS transmission rates, and drug-related crime. If a nation like the USA were to implement the same decriminalization policy as the one in Portugal, then the positive benefits shown in the graphic for Portugal would likely transpire in the same way for America. All in all, the decriminalization and regulation approach is the only logical way for America to effectively solve the drug problem. Decriminalization and regulation of drugs improves public health outcomes, reduces the burden on the criminal justice system, and offers substantial economic benefits. It reduces drug-related harms. Also, treating drug use as a public health issue, as seen in successful models like Portugal, is both feasible and beneficial. As we consider drug policies, it's crucial to learn from these examples and the strong evidence supporting them.